Hello, welcome back. I'm Dr. Anthony Wheeler, and I'm going to tell you everything that you need to know about pathology. Do you know what's happening in this image to the right? What condition that is? You see that apple green birefringence? That's amyloid, right? We're probably looking at that with a polarized light source. It's actually very pretty. In today's discussion, we're going to be discussing amyloidosis, right? Make sure you have the book Medical School Pathology in Step 1 Review. It has everything that you need to excel in pathology in your coursework and on Step 1. It's very fundamental to have this book. It pairs with all the material that I'm discussing, and it is a very, very, very useful resource. Amyloidosis. Okay, let's get into this. Amyloid refers to various fibrous, extracellular, and proteinaceous deposits. Amyloidosis is the abnormal buildup of amyloid in various tissues of the body. Types of amyloidosis include AA amyloidosis, hereditary amyloidosis, also known as familial amyloidosis, wild type amyloidosis, localized amyloidosis, and AL amyloid due to the immunoglobulin light chain amyloidosis. Regarding amyloidosis, the beta-pleated sheet configuration of amyloid is common among amyloidosis. Beta-pleated sheet. What's the classic stain for amyloid? Congo red. You will be asked that. The classic stain for amyloid is Congo red, which under polarized light has a characteristic apple green birefringence when viewed microscopically. The deposition of amyloid may occur localized, right, to one organ or something, or systemically throughout the body. Localized amyloidosis is defined as amyloid deposition in a single organ. Examples of localized amyloidosis include senile cardiac amyloidosis in the heart due to non-mutated serum transthyretin, familial amyloid cardiomyopathy due to mutated serum transthyretin, in contrast to the non-mutated serum transthyretin and senile cardiac amyloidosis. With type 2 diabetes mellitus, amylin from excess insulin. Regarding Alzheimer's disease, alpha-beta amyloid, or dialysis-associated amyloidosis, beta-2 microglobulin, or medullary carcinoma of the thyroid due to calcitonin. So these are various forms of localized amyloidosis, some conditions that they are associated with, and in parentheses, the type of protein that is accumulating. Regarding senile cardiac amyloidosis, that is due to buildup of non-mutated serum transthyretin in the heart, and that may lead to restrictive cardiomyopathy. Familial amyloid cardiomyopathy is due to something that would be inherited familially, so it's probably already mutated, right? That's a good way to remember it. Familial amyloid cardiomyopathy is due to mutated serum transthyretin that deposits in the heart, causing restrictive cardiomyopathy. If you can imagine a heart with extra proteins being deposited in it, It makes sense that it becomes rigid and restrictive in structure, right? Type 2 diabetes mellitus may cause amyloidosis by amylin being deposited in the pancreas islets. Alzheimer's disease is associated with alpha beta amyloid depositing and forming amyloid plaques in the brain. Dialysis associated amyloidosis is associated with beta 2 microglobulin depositing in joints. And medullary carcinoma of the thyroid results in calcitonin deposition in a tumor in an amyloid-like fashion. Now, who would have medullary carcinoma? You know this. It's one of the men syndromes. Do you remember which one? If you don't remember, we're going to discuss it later. But make sure you bookmark that and keep it in your mind. I know you're looking it up right now. Either way, we're going to get into it. But let's stay on topic here. Systemic amyloidosis. Systemic amyloidosis results in systemic deposition of amyloid. Systemic amyloidosis may be due to primary amyloidosis or secondary amyloidosis. Regarding primary amyloidosis, AL amyloid, which originates from the immunoglobulin light chains, is the main protein. In secondary amyloidosis, AA amyloid, which is derived from SAA, an acute phase reactant that is increased in certain conditions, is the main protein. Conditions that result in SAA include familial Mediterranean fever, and that's due to dysfunctioning neutrophils attacking serosal surfaces, malignancy, and chronic inflammation. Primary amyloidosis is associated with multiple myeloma and other plasma cell dyscrasias, such as plasmacytomas and monoclonal gammopathy of undetermined significance. Secondary amyloidosis is systemic deposition of a amyloid which is originating from the serum amyloid associated protein. Serum amyloid associated protein is an acute phase reactant associated with chronic inflammation and cancer. Clinical conditions associated with systemic amyloidosis include nephrotic syndrome, most commonly, restrictive cardiomyopathy, hepatosplenomegaly, right, big liver and spleen, macroglossia, tongue enlargement, and even a thickened bowel. Nephrotic syndrome is a kidney disorder that causes proteinuria. Nephrotic syndrome is a kidney disorder that causes proteinuria. You're going to see that later. The diagnosis of amyloidosis is made by biopsy. And unfortunately, there's no procedures to date to remove amyloid. So amyloid cannot be removed. Organs damaged by amyloidosis must be transplanted if warranted. And that wraps up amyloidosis and amyloid pathology in general. Make sure you have this lecture down pat. Definitely all this stuff is fair game for questions and whatnot. You will definitely see it. Congo red stain, you will see it. You'll be asked about it for sure. Happy studying. Keep up the good work. You're on the right track. I'm proud of you. You're going to do great. Make sure you have the book so that you can take notes in the margins, mark your notes, your comments, and suggestions. Make sure you're subscribed so you don't miss out. and I'll see you later.